We also want to talk, March is Colorectal Cancer Awareness Month. So let's talk about the stats for this type of cancer and kind of how they differ between men and women, if we could.
So colorectal cancer screening for average risk people actually starts at the age of 45. And what we know is in 2023, about 150,000 approximately people were diagnosed with this cancer. Over 50,000 died from this cancer. And out of that number, close to approximately 19,000 people were under the age of 50. So very important that you start screening if you have average risk at 45 onwards.
Yeah, and I think a lot of people, it's easy to be lighthearted about getting checked, but I mean, really, what are some things that you can kind of detect as far as risk factors for yourself if you might have it?
Right, so you can actually detect polyps that are precancers at a very early stage, and sometimes early stages of colon cancer don't necessarily have symptoms, but some people can have symptoms like rectal bleeding or abdominal pain, excessive fatigue, anemia, change in bowel habits, and those are some of the signs. But these screening tests actually are able to diagnose polyps at an early stage, leading to, curing of the cancer.
Sure, early detection in any type of cancer, always good. What about how often should you be getting screened?
It depends on what type of testing you get. So number one, the gold standard is actually colonoscopy, which is a direct visualization of the colon. For average risk patient, that's about every 10 years. Now there's a visual CT colon test that's about every 5 years. There are some stool testing called FIT test, which is fecal immunochemical test, as well as Cologuard testing. Those range between 1 to 3 years. And really, like, depending upon what mode you are choosing, you can go and discuss with your doctor on frequency of those tests.
Okay, so good to talk with your physician again. And lastly, Dr. Sonal Harder, we want to ask you anything that people can be doing to lower their risk, of course, the most important question.
So we know that the risks are getting older. So over the age of 50, make sure you're getting your screening tests done, also maintaining healthy weight, healthy lifestyle, diet that's rich in fiber, vegetables, whole grains, and fruits, also abstaining from tobacco and cigarettes, maintaining your alcohol intake at a healthy consumption. Those are some things that are fully under our control.